So my name is Dr Annabelle Plyming. I'm a consultant working in palliative care. I work here in Durham, I work at Willow Burn Hospice and also with the community palliative care team in North Durham and Derwentside, and additionally I work at the University Hospital of North Durham in Durham itself. So advanced care planning is a process or a time when people start to think about what is important to them and their wishes, particularly in the context of hospice or palliative care, what will be important to them as they become more unwell or perhaps are approaching the end of their life. It can be done before people are unwell. It might be that they think of this at a particular point when they have a diagnosis of a life-limiting illness, or it might be something that they think of because they're aware of others, of loved ones or family members, for example, who have a serious illness or a particular incident's happened, and they want to take the time and think about that for themselves. So this might be thinking about their own personal situation. They might want to think about finances, planning for other family members in the future, perhaps thinking things about wills or funeral plans if that's something that's important to them. And in the context I'm working in, it involves thinking about healthcare, wishes around what people would want as they become more unwell and what they wouldn't want. That might be treatments that they would like to have if they're possible and available, and medically the right thing to do. It might be treatments that they definitely wouldn't want. And advanced care planning involves then sharing that with their families and loved ones as well. Anyone might benefit from thinking about this. As I say, you don't necessarily have to be ill or have a serious diagnosis. I know a lot of people, myself and my husband included, thought about some of these questions during the COVID pandemic, when we were all wondering what was going to happen and worried about how everything was going to work out at the very beginning of the pandemic. A lot of people I see are thinking about this because they have just been given a diagnosis of a serious or a life-limiting illness. And sometimes that will focus the mind on particular questions. It's not about being miserable or taking away hope, but it's thinking about, well, I know something is going to happen. I know that my life is perhaps different or changed or is not what I thought it was going to be. I know there's going to be an end or I'll become more unwell, and it's that opportunity to think about it and to share with others so that they're able to reflect my wishes when the time comes. It might be, for example, someone has a diagnosis of dementia and they want to make decisions earlier on while they are able to, because at some point they won't be able to make the decisions for themselves. An advanced care plan is usually a written document where someone has written down what their wishes are for treatments they would and wouldn't want. In healthcare in County Durham, we often use something called an emergency healthcare plan. There are other documents elsewhere like a respect form, and sometimes there are other documents relating to particular treatments that people do or don't want or aren't right for them. That may be around resuscitation, or sometimes particular treatments that they would refuse and want to have the legal backing for that, such as an advance decision to refuse treatment. It may also be involving family or other loved ones as part of that planning, and arranging for the family member, for example, to have lasting power of attorney. So when someone is not able to say what they want for their care, for healthcare or for their finances, they've nominated someone to represent their wishes in that case. In an advanced care plan, this is written down. This is a document that will be available in someone's house or in their home, can go with them into hospital. It will say what some important health information for them. It will talk about particular illness if that's the case, what treatments they have had already, if someone is hoping to stay at home or intending to stay at home, it will list what treatments they have in the house already, and it will be available partly for the person themselves to refer to and update as things change, for their family to look at for information so that they know those wishes are written down, and particularly for healthcare professionals. So if someone's going into a person's house to see them, they know what care is wanted and not wanted. Advanced care planning is really helpful for families and for loved ones, as well as for the person themselves. Thinking about these things gives a chance to discuss, so it's very clear what someone would want. For example, if I see patients with particular illnesses such as cancer or heart failure or liver problems or kidney failure, there is likely to come a point where they are unwell and not able to tell me themselves what they would want. It may be because they're very sleepy or because they've become muddled or confused because of their health condition. If they've had an opportunity to talk about this with family or loved ones beforehand, their family are able to represent their wishes when healthcare professionals, whether that's doctors, paramedics, nursing staff, and that may be hospital, home or community, the family know what someone's wishes are to be able to pass those on to the healthcare professionals, so that the healthcare professionals know that they are doing the right things by that person. That could be something as simple as somebody saying, well, I know I have advanced cancer. When the time comes, I'm at the end of my life, I'm dying, I would like to stay at home for my end of life care. If the family are able to express that, if the family know that, they'll be able to support the person and advocate for them with healthcare professionals, and they know to ask a bit earlier in the planning process so that we can make sure those wishes happen. If somebody is unwell and it's a situation they haven't thought about in advance and it isn't written down in a healthcare plan, an emergency healthcare plan, that's fine, because if you've had some of those conversations already, then we can apply those principles and it gives us a good idea of what people would want, so they have the best care that they would want at the end of their life.